All right, welcome back. We got about two more lectures, and then we are going to be done pretty much for the year. So we'll go ahead and get started today where we left off with fainting. All right, so fainting, so just kind of signs and symptoms of someone who may faint. Obviously, they may become pale or begin to sweat or complain of dizziness or weakness. And again, you may be able to prevent a person from fainting by having the person sit down and put his or her head between his or her knees or lie flat down on their back. The medical term for fainting is actually syncope. Just a little fun fact there. So, with fainting, if a person is responsive, we'll check for injuries that may have happened as a result of the fall. We can put that person in the recovery position. And if we have any doubt about their medical condition, we want to go ahead and call 911. If not calling 911, recommend that they follow up with their healthcare provider. If the person faints and is not responsive, again, just like anything else, we want to go ahead and start CPR and get the AED as soon as possible. All right, so a stroke, signs and symptoms of a stroke. They're going to have trouble with speech and language, including slurring of words, being unable to form words, or being unable to understand what others are saying. They may drool or have trouble swallowing, may have drooping features on one side of the face, i.e. the eyelid or the corner of the mouth. They may also have trouble seeing from one or both eyes. May also have weakness or paralysis or numbness of the face, arms, or legs, especially when it's on one side of the body. Could also have a severe headache, dizziness or a loss of balance, confusion, or unresponsiveness.
If you think someone might be having a stroke, conduct a FAST check. F stands for face. Ask the person to smile. Does the person's face look uneven, or is there drooping or weakness on one side? A is for arms. Ask the person to raise both arms in front. Does one arm drift downward or appear to be weak? S means speech. Ask the person to repeat a simple sentence, such as, "The sky is blue." Does the person have trouble speaking, or are the words slurred? T equals time. If the person has trouble performing any of these actions, or shows any other signs and symptoms of a stroke, note the time that the signs and symptoms started and call 911 or the designated emergency number immediately. When a person is having a stroke, every minute counts, so act fast.
Okay, so with stroke, we want to go ahead and use that FAST acronym to kind of assess where they're at and if we need EMS. So F for face, you can ask them to smile and see if there's weakness or drooping on one side of the face. A is for arm, see if they can raise both arms or if one appears weak. S is for speech, so see if they're able to speak or if their speech is slurred. And T is time, so if they're having difficulty with any of these actions, we want to call 911 as quickly as possible. So again, if we think someone has had a stroke, call 911, and we want to note the time at which they first started having the signs and symptoms of the stroke, so we can relay this information to EMS. We want to reassure the person until EMS arrive, and if they are responsive but not fully awake, or if the person is drooling or having trouble swallowing, you may want to put them in the recovery position and monitor their condition until EMS personnel arrive. All right, so moving on to some injuries. Again, a lot of this should be review, but it may be on the test, first aid test at the end.
To care for someone with an open wound, begin by covering the wound with a sterile gauze pad and applying direct pressure until the bleeding stops. If blood soaks through the first gauze pad, put another one on top and press harder to apply more direct pressure.
Okay, here we go.
It may take several minutes for bleeding to stop. Do not remove any gauze pads. If the bleeding does not stop, Call 911 if you have not already done so. Continue to care for the person and monitor for shock.
So I'm going to check your circulation, okay?
Okay.
Okay. I need you to replace my hand right here. Very good.
Just like this?
Yeah.
Okay.
Okay? Thank you.
Once bleeding is controlled, check for circulation beyond the injury. Note the temperature and color of the skin and ask the person if there is any tingling or numbness.
Any numbness or tingling of any kind?
No.
Okay. So I'm just going to get a bandage. Okay. I want you to just hold that for a moment, all right?
Okay.
Place the end of the bandage on the dressing at a 45-degree angle. Continue wrapping the bandage over the dressing.
Yeah. Thank you for holding that for me.
No problem.
Thank you. You're a good assistant.
Thank you.
We'll get this done. One more. Okay.
Once the dressing is covered, roll out the remaining length of bandage. While holding the bandage, use the index finger of the other hand to split the bandage in half, moving it down and underneath the limb. Bring up the two ends of the bandage and tie them in a bow or a knot.
Okay. So I'm going to check your circulation again, okay?
Okay.
Okay.
Check again for circulation beyond the injury. If there is any change, the bandage may be too tight, and you will need to carefully loosen the bandage.
Feel any numbness or tingling or anything like that?
No.
After the bandage is appropriately applied, remove your gloves and wash your hands. Most kids get cuts and scrapes once in a while. Knowing how to care for these minor wounds will let them get back to playing quickly. But keep in mind, blood can be frightening to
Honey, I'm gonna
kids.
put a dressing on that
While
cut,
providing
okay?
care, talk to the child and make her feel more comfortable.
Here we go.
Begin by covering the wound with a sterile gauze pad and applying direct pressure until the bleeding
You're being
stops.
such a brave little girl. Looks like the blood is still coming through. I'm going to get another dressing for you. I want you to replace my hand on the count of three, okay? You ready? 1, 2, 3. Okay. Good girl. So I'm going to put this back on. 1, 2, 3. There we go. There we
If
go.
blood soaks through the first gauze
We're a
pad,
good team.
put another
We're a
one
good
on top
team. Yes,
and
we
press
are.
harder to apply more
Good
direct
job.
pressure.
Good job.
It may take several minutes for bleeding to stop.
Oh, I
Do
know
not
it
remove
hurts.
any
I
gauze
know.
pads. If the bleeding does not stop, call
Now we're gonna check
911 if you have
circulation,
not
okay?
already done so.
Okay, so I want you to
Continue to
replace
care
my
for the
hand with
person
yours on the
and
count of
monitor
three.
for
Ready?
shock.
1, 2,
Once
3.
bleeding is controlled, check for circulation beyond the injury. Note the temperature and color of the skin and ask the person if there is any tingling or numbness.
Any tingling or numbness, honey? No. You sure? Yeah. Okay, we're almost done. Okay, you hold on to that and I'll be right back. So we're going to put a bandage on. So I want you to move your arm, your hand up.
Place the end of the bandage on the dressing at a 45-degree angle.
Put your finger right there for me. Thank you. I'm going to place your finger now.
Continue wrapping the bandage over the dressing.
Almost done. We're almost done.
Once the dressing is covered, roll out the remaining length of bandage. While holding the bandage, use the index finger of the other hand to split the bandage in half, moving it down and underneath the limb.
We're
Bring up the
almost
two
done.
ends of the bandage and tie them in a
Almost
bow
done.
or a knot.
Hang in there. Hang in there.
Check again
we're
for
gonna check
circulation
circulation
beyond
again,
the
okay?
injury. If there is any change, the bandage may be too tight, and you will need to carefully loosen the bandage.
Any tingling or numbness?
After the bandage is appropriately applied, remove your gloves and wash your hands.
So dealing with bleeding in children, pretty much the same as an adult. Just understand that it is a child and they may freak out a little bit. So you need to kind of reassure them. Go ahead and give that girl an Oscar because she did a great job acting. So a little more advanced care for bleeding. We can, in some life-threatening scenarios, use a tourniquet. This is a device that's placed around an arm or leg to constrict blood vessels and stop blood flow to an open wound. We have an example here of a medical-grade tourniquet. So the only reason or the only time we would use a tourniquet is going to be when life-threatening bleeding exists and standard first aid procedures fail or they are not practical. So life-threatening severe bleeding that cannot be controlled using direct pressure or a physical location that makes it impossible to apply direct pressure to control bleeding, or if there are multiple people with life-threatening injuries who need care, or if we have a scene that is or becomes unsafe. So all reasons we may use a tourniquet.
A tourniquet should be used, if available, when life-threatening bleeding exists on an arm or leg and standard first aid procedures fail or are not practical.
Apply pressure here. All right, I got it.
Tourniquets can be painful. If you must apply a tourniquet, make sure the person understands the reason for the tourniquet and warn the person that it might be painful. To begin, place the tourniquet around the limb, approximately 2 inches above the wound. Avoid placing the tourniquet over a joint. Route the tag end of the strap through the buckle or attach the quick connect buckle and pull the strap until tight around the arm or leg. Tighten the tourniquet by twisting the rod until the flow of bright red blood stops. Then, secure the rod in place using the clip or holder. If bleeding restarts or the tourniquet is ineffective, apply more pressure and tighten tourniquet, but do not remove it. Note and record the time that you applied the tourniquet and give this information to EMS personnel when they arrive. Continue to care for the person. Monitor for shock until EMS personnel arrive.
So again, although graphic there, we are only using tourniquets in scenarios where we cannot control the bleeding any other way, and it could potentially be life-threatening. Okay, so dire circumstances would be times we would use a tourniquet. So when we talk about bleeding, a hemostatic dressing, this is going to be a dressing that's treated with a substance that's going to speed clot formation. So if we have a hemostatic dressing, we can apply it at the site of the bleeding, even if it is inside of a wound. And we could use these hemostatic dressings, again, if we have them available, and we can use them along with direct pressure. Again, it will speed that clot formation, which will help to control the bleeding quicker. So hemostatic dressing should only be used to control life-threatening bleeding when standard first aid procedures either fail or are not practical. Again, life-threatening bleeding on parts of the body where a tourniquet cannot be applied, such as the neck or torso. This would be a great time to use a hemostatic dressing, as well as life-threatening bleeding from an open wound on an arm or leg if a tourniquet proves ineffective. Would all be times when we could use a hemostatic dressing. Continuing on with bleeding, some common causes of nosebleeds, also called epistaxis. That's the medical term for a nosebleed. Can be due to trauma, such as getting hit in the face, exposure to dry or cold air, high blood pressure, as well as the use of certain medications, such as blood thinners, all common causes of nosebleeds. So to care for a nosebleed, we want to have the person sit, leaning slightly forward, and we want to pinch the nostrils together until that bleeding stops. We don't want to have them lean back, as that blood could kind of go down the throat, and you could potentially choke or vomit from the taste of the blood. So we'll have them lean forward, pinch the nostrils until the bleeding stops. If the nosebleed is severe or it is not able to be stopped in about 5 to 10 minutes, we may have to call 911 but we do want to continue to pinch those nostrils together. Okay, moving on to burns.
Burns can be caused by contact with extreme heat, chemicals, radiation, or electricity. Burned areas can appear red, brown, black, or white. You may see swelling, blisters, or both. To care for any type of burn, remember 3 simple steps: stop, cool, cover. After sizing up the scene, stop the burning by eliminating the cause of the burn if it is safe to do so. Next, cool the burn using cool or cold clean running water for at least 10 minutes. Finally, cover the burn loosely with a dry, sterile dressing. Burns involving blistering or broken skin should be evaluated by a healthcare provider. Some burns are minor and require only first aid care, but others are critical and require a call to 911 or the designated emergency number. To decide whether a burn is critical, look at the following factors. What caused the burn? Burns caused by electricity, chemicals, nuclear radiation, or an explosion are considered critical burns. How deep is the burn? Burns can affect only the top layer of the skin, or they can extend through the deeper layers of the skin or the fat, muscle, or bone underneath. The deeper the burn, the greater the severity. How much of the person's body is burned? A burn that covers more than one part of the body or covers a large percentage of the person's total body area is considered a critical burn. Where is the burn located? Burns in areas where they could impair function or the person's ability to breathe, such as the head, neck, hands, feet, or groin, are considered critical burns. How old is the person? If the person is younger than 5 years or older than 60 years, consider the burn critical unless it is very minor. If you think that a person has a critical burn, call 911 or the designated emergency number immediately.
So as the video stated, first step in care for burns is obviously to stop the burning. So for a thermal burn, we want to remove the source of heat. For a chemical burn, we want to remove any contaminated clothing if it is at all possible. If the chemical is a liquid, we want to flush the area with cool running water for 20 minutes or until EMS show up. If it is a dry powder, we want to put on gloves and brush the chemical off the skin. Then we want to flush the area with cool running water for about 15 minutes or until EMS arrive. If it is an electrical burn, we want to turn the power off at its source. So we want to cool the burn using cool or cold potable water, meaning water that's suitable for drinking. We can cool the burn as soon as possible and for at least 10 minutes. If cool or cold potable water is not available, a cool or cold but not freezing compress can be applied instead. Once that's done, we want to cover the burn loosely with a sterile dressing. If a sterile dressing is not available, a clean dressing or plastic wrap may be used to cover the burn. All right, we will stop there for today. Reminder, we'll have basically one more lecture, and then next week will be when your first aid exam will be due.